try to cover a few points that have been covered by some of the people before me, and you've really had a pretty full diet, because I know everybody's hungry. They should be. If not, they've got an occupational disability. You know, I think some people may feel a little disappointed that we don't have maybe 100 or 200 people here. It reminds me of a conversation I had a few weeks ago with somebody who had some money burning in their pocket, and they wanted to start an organization with 1 million people. This person was very disenchanted by what had happened in the election and felt that if we just get 1 million people that would put pressure on Washington, that somehow or other they could turn things around. Well, I have reached the point in my life where I'd rather deal with 25 or 50 dedicated people that know where they're going. Jerry Voorhees, who was a great congressman, who was one of Richard Nixon's first targets, once said that you could change any congressional district in America if you had 6 people who knew what they were about to do and set out to do it. And I feel that way about occupational health. We have a small group of people in Washington and across the country who are very perceptive people who are constantly working on this problem, and gradually I think we're making some changes. I'm a late arrival on this scene. I spent about 10 years in Washington worrying about banks and corporations and some of the far-flung topics that labor lobbyists get involved in. And I just sort of stumbled into occupational health. I worked on the Kohler strike in 1953, and yet there, right in front of us, was one of the toughest working class working conditions problems of all time, the enamel shop. In fact, that was one of the things that kicked off the strike. And yet I was not really at that time aware of the deep significance of that particular problem. I don't know whether any of you noticed the Hull House out here. It's very appropriate that we should be having a meeting right in the shadow of Hull House, because Dr. Alice Hamilton was the founder of the occupational health movement in this country, and she worked very closely with Jane Addams. And they worked at Hull House, and you should read, if you get a chance, the book Exploring the Dangerous Trades by Dr. Alice Hamilton, because she was much more than just a doctor. She was a great human being. She was part of the anti-war movement. She was a radical and social reformer, and she was also a person who spent her life working to eliminate health hazards on the job. I'm sorry that Tony Mazzocchi and Susan Dahm are not here, because they are really some of the great people in this movement. Dr. Dahm and Gene Stillman have put together a book which will be coming out in the fall called Work is Dangerous to Your Health, and I hope that you will, it's going to be both hardcover and paperback. I think the paperback will sell for $1.95, so it's going to be the fundamental book, and it really picks up the cause where Dr. Hamilton left it. I was at a conference on noise recently, and I found out that the little city of Palo Alto, California, has been able to train 20 police officers to take noise measurements and to find people for violating the city's noise ordinance. Now, I do a lot of traveling back and forth, and I've gotten very accustomed to being searched these days. I called up the Federal Aviation Administration the other day, and they tell me there are 8,000 people now have been assigned to airports to search people. We have in OSHA less, I don't think somebody said 1,000, I don't think we have 500 compliance officers to cover the working conditions of 82 million people. There's 60 million covered by the law in about 4 million workplaces. So we have 8,000 people working at airports to protect the jets. I've always hoped that I'd get on one of those planes going to Cuba, and maybe I could even stay overnight to find out what it's like down in Cuba. I never bothered about that, but of course it's an inconvenience to the airlines, and they make money. And so we found the wherewithal to get 8,000 airport guards, and they don't work all the time. Between flights they're sitting around playing pinochle and everything else. So if we can as a nation, make a commitment for 8,000 airport guards, certainly we ought to be able to find the wherewithal for as many occupational safety and health compliance officers. Somebody in HEW said that we should have one industrial hygienist for every 35,000 workers. If we had that kind of a ratio, we'd have 8,000 industrial hygienists. At present, we have about 50, which means that we have one industrial hygienist for every 1 million workers covered by the law. And I hope that in this group, some of you will be stimulated to get into industrial hygiene. I think it's one of the great growth industries of America. In spite of the fact that people don't turn out to big meetings like this, when we had our production workers conference in Atlanta, Georgia, as a preliminary to our special convention on collective bargaining, 2 solid hours was spent on health and safety questions. 2 solid hours. And I couldn't have written the speeches better myself. In fact, believe me, they said some things. The brothers and sisters who spoke on the floor at Atlanta, Georgia, said some things that I hadn't even thought about. We're spending about 50 cents per worker in this country for enforcement purposes of the National Safety and Health Law. And of course, you all know that there are more fish and game wardens than there are safety inspectors. Right now, we're having a real life and death struggle to set some kind of a safe noise standard. The law says that any advisory committee which is set up to study a standard like noise has to be open, has to be a public meeting. Believe me, that was something we fought for. That's part of your health and safety rights in the law. And it's a real eye-opener to see it, because you've got all the experts from industry, and then you've got a few people from labor who are trying to keep track of what's happening. And the big fight right now is whether it's going to be 90 decibels or 85 decibels. Now, those of you who know anything about this know that it's on a logarithmic scale, so the difference between 90 and 85 is not 5, it's 500 times. And if you can get the noise down from 90 to 85 decibels, it's a substantial improvement. In my book, and I'm not really plugging the book, not much, I only make 9 cents a copy, so I'm not going to get rich on that book, but there is a chart that shows that when the noise levels get above 80 decibels, now we're talking about 90 and 85, but when the noise levels get above 80 decibels, you're condemning a predictable percentage of the workforce to some kind of occupational loss of hearing. So the level really should be 80 decibels. But we're talking now about 90, and we're trying to get it down to 85. And there is a life and death struggle that affects literally 20 million workers in this country over whether that standard is going to be 90 or 85. And fortunately, we're able to sit in those meetings and find out what's going on. And one of the things that's going on is that there are people who are saying, and they represent industry, that the only way to solve this problem that's practical and feasible is to give people ear protection. And that's the way you solve it. You don't eliminate the source of the noise. Now, there were a lot of people who lived in the path of airport noise who got on their high horse and raised hell, and we got a Noise Control Act. You know, we can somehow do big things when it affects, nobody worried about air pollution until the bad air started getting out into the residences of the big 3 automobile executives. And the same thing is true now in noise. Working people have been putting up with this kind of stuff for years, and nobody really cared anything about it. But so the industry's answer is to give you an earplug or ear protectors. Now the law and the regulations now say that you should have personal ear protection for noise purposes, but there has to be an engineering program to eliminate the source of the noise. That's the way it is now, and we shouldn't do anything to weaken that, because if we can spend $28 billion to get to the moon and back, we can find ways to bring noise levels down at the workplace. And we can do it for a lot less money than $28 billion. You know, report to Congress on the law says that there are 100,000 people dying a year from occupational diseases. You know, the National Safety Council has been telling people for years that you're safer going to work in the morning than if you go on the public highway or you stay home. More people are killed. Now that's true. Maybe 14,500 physical accidents lead to death. But now the new report from NIOSH says that 100,000 people are dying a year from exposure on the job, some of the things that Dr. Miller was talking about. That's 400 deaths a day. That's 50 deaths an hour on an 8-hour day, 2,000 hours in a work year. Now, if we had headlines in the paper that there were 50 people killed in a single hour or 400 people killed in a single day, that would be bigger than any catastrophe that this country has ever had. And yet that is what is happening. And few people are getting stirred up about it. Although, as I said, our Atlanta Production Workers Conference was a sign that our union, and I think that the UE and the OCAW certainly, if I missed any unions that are here, I think the labor movement is beginning to address itself to this. 8 times as many people then are dying from occupational insidious type diseases. One of the groups which has done a lot of work with us is the Health Research Group. It's a NADER offshoot, and they have a staff of lawyers and toxicologists and doctors that are assisting us. And we right now have a miniature shell strike in Delaware. Involves only 250 people in a lead battery plant. But the NADER people moved in there a week before that contract expired, and they set up some recommendations, and the local union, which had been struggling with this problem for 2 or 3 years, they'd been using the government, they'd gone to OSHA, they'd gone to NIOSH, they'd gone to our own industrial hygienists. They had not been able to come to grips with this particular problem. Within 1 week, 3 guys from the NADER Health Research Group came up with a plan of action and a strategy, and they're on strike right now to try to get a meaningful health and safety program that will keep the lead levels down, both in the plant where they work and also in their own blood. And that's the kind of thing that's happening. Now, what can health activists, what can MCHR people do? You've got to have more than goodwill. I think one of the groups that has done a tremendous amount of good for the labor movement is the Urban Planning Aid up in Boston. They have developed health hazard information which working people can understand. That's part of our problem, you see. So much of the technical stuff that is around in this field is very difficult for people. You know, the UAW pays me to sit in my office and read. And I get paid to read this stuff, and I can't figure out some of these things. I spent weeks and months trying to figure out what some of this technical stuff is. We need somebody who can interpret this kind of information so that anybody can understand it. I consider the Wall Street Journal a kind of a publication that anybody can pick up and understand. They can take the most complicated material and write it in unfoggy sentences so that anybody can understand. That's what we need in this whole question of occupational health. We need better communication, better understanding of what the hazards are. And these kids up in Boston are living on food stamps and the cold water flats, and they've taken all this high-powered stuff and they've reduced it down to the kind of information that anybody can understand. For the first time in my life, I understood some of the significance of solvents because they put out a health hazard sheet on solvents, the degreasers. They've done the same thing with oil mist. And that's the kind of stuff that I think MCHR people can do because, you know, we can plow through some of this technical stuff and we just get dizzy trying to figure it out. It's very hard to understand. You know, someday we're going to have a public service announcement that says, warning, noise, dust, fumes at your job are dangerous to your health. You have a right to a safe and healthy workplace. Call this 24-hour, 7-day toll-free number and you will get help and assistance. That day is going to come one of these days, and the kind of people who are attracted to MCHR, the health activists, the future doctors, and the health professionals are the kind of people that should be on the other end of the line answering that telephone when a worker, man or woman, depending on, no matter what the job is, blue collar, white collar, asks for help. For instance, just the question of industrial ventilation. There's a wonderful manual called the Manual for Industrial Ventilation, but very few people can understand that manual. We need somebody who can take that information and simplify it. About 85% of our occupational health problems are problems of proper ventilation. And if working people had better information on industrial ventilation, I think that a lot of our problems could be solved at the workplace. We need people to monitor the law. Senator Taft has put in a new bill called the Respiratory Diseases Benefits Act, which says that you should get some kind of compensation for any kind of lung damage. Well, Dan Berman went through that law and he found a lot of things that were wrong with it. It's a good idea, but it was obviously written by a conservative who must have some point of view, and Dan spotted a lot of those things. Well, we need that kind of help, and people in MCHR can provide it. A lot of MCHR people, a lot of young people across the country have helped us evaluate these state plans that George Struggs was talking about. See, we passed the federal law because the states had done a lousy job. And then Nixon came in and said, well, let's give this whole program back to the states. So you got 50 stacks of paper that have been prepared by various state governments. And it takes somebody with patience and imagination to go through that stuff and find out what's wrong with these state plans. I know you've done that in Illinois, and it's been happening in some other states. We have this safety shoe case, which was George Struggs talked about. That's going to decide whether employers under the law are required to pay for personal protective equipment. Safety shoes, the whole business. That's going to be a landmark case, and OCAW has got a Georgetown law student right now finding out what's going on in that case, and they've taken this person out of law school, and he's been getting a real education on the politics of occupational health. It's going to be a very important case. We need a lot more help on workman's compensation, because that's when health and safety fails, then we have to turn to workman's comp. And we find right now that working people are getting about 40 cents out of every dollar that is paid after a person files a claim and is able to collect. The rest of the money goes to lawyers and to insurance companies. So the actual worker who's supposed to benefit from workman's comp is only getting 40 cents out of every dollar. We also found recently that if under existing state laws, just for loss of hearing alone, workers should be able to collect each year $2 billion in loss of hearing cases. Why doesn't that happen? Most people are intimidated. They don't know that the law is there. The law is very complicated, and it's written in a way that you can't very readily claim your rights, and there's $2 billion going down the drain that should properly belong in the pockets of working people, and would be a deterrent. It would force companies to eliminate the noise. If industry in this company had to kick out $2 billion for loss of hearing claims, they'd find ways to, and that was the purpose, that was the original purpose in workman's comp, to make it so costly that you would eliminate the source of trouble. Now, if we had stronger loss of hearing laws, of course, it would be more than $2 billion. If a person has worked for 5 or 10 years at a noisy job and he suffered some loss of hearing, it ought to be just like that. He ought to be able to collect a loss of hearing compensation claim. But it isn't that way. You have to sometimes be off the job for 6 months before you can even go in and claim a loss of hearing. So there's something that ought to be done in workman's compensation. As I pointed out earlier, there are about 3 million workers of the 2 million that are exposed to noise that are actually suffering loss of hearing right now because of this 90 decibel standard, and it ought to be down to 80. We have this whole question of carcinogens, cancer-causing chemicals. We had a young kid, I knew him when he was about 2 years old. His father is a political director of the UAW. He's a medical student, second-year medical student at Johns Hopkins. He spent all last summer researching all the information that was available on those 10 cancer-causing chemicals that was put in the petition by the Health Research Group to try to ban these from the workplace. You heard some people allude to that. There are 10 chemicals that have been identified as causing cancer that are presently being used in the workplace. The Secretary of Labor, under the present law, has the power to say those can't be used at the workplace. And it was a it was a second-year Johns Hopkins med student. He's a sophomore in college. He isn't a med graduate student. He spent his summer researching this, preparing the basic information. That's the kind of things that can be done. Now, I think one of the reasons we have problems in occupational health is it's hard to identify these things. You know, if you're working in a plant and you're not getting your rate for your job, you're not getting your vacation that is supposed to be in the contract, you know that. That's something that's very easy to measure. You can figure that out. But if you're working at 90 decibels or you're working at some kind with some kind of a chemical that's got some fancy code name, that's very difficult to figure out. Now, I think more and more people are getting smart to this, and that's one of the things that's happening. And I think we have to thank the environmental movement. You know, we used to get all excited about the redwoods and a lot of other things, and a lot of people would come up to me and they say, why should I worry about the redwoods? Because the air where I'm working is killing me. And I think people are right, but at least the environmental movement has made people open up and realize that there's more to life than just earning so much in your paycheck. Well, I get the signal here that it's time to wrap it up. I've got a thing on the Sierra Club that they've got a lawsuit that's going to prevent runaway plants, but I'll save that for one of the sessions this afternoon, because the environmental movement, the health professions, and the labor movement have got to work together, and I hope we can find a way to do it.